Welcome. I'm Dr. Jen Bickerton, founder of the Vitamin Advisor. I'm here with Dr. Emmanuel Apostolidis, the co-founder of Nutramins, along with President O, and Dr. Kwon from Kunpoong Bio, the developers of KitoMax. Mr. Cheng Gam O is the founder and CEO of Kunpoong Bio, KPB. KPB is based in South Korea and is a global leader in the production of enzymatically digested chitosan oligosaccharides using a patented technology for more than 30 years. Since 2008, KPB has been performing R&D activities to develop branded and clinically validated ingredients for the management of metabolic syndrome, such as KitoMax. In 2018, KitoMax received a health claim certification by the Korean FDA for suppressing postprandial blood glucose levels. We also have Dr. Young-In Kwon. Dr. Kwon is a professor at Hannam University and a scientific advisor for Kunpoong Bio. Under this capacity, he was the leading scientist that performed all the translational research, both clinical and preclinical research, with KitoMax to define its health benefits for normal glucose levels. Dr. Kwon will be answering our questions in this interview, and President O will be offering support as needed. Thank you both for being here today.
Thank you. Nice to meet you.
Nice to meet you too. Today, we will be discussing the difference between chitosan and chitosan oligosaccharides, which is also known as the branded ingredient KitoMax that Nutramins is using in their glucoraze formula, which is one of my favorite Nutramins products. So the first question I want to ask is, first of all, what is chitosan and where does it come from?
Yes. Chitosan is a dietary fiber. It's derived from the cells of crustaceans such as crabs and shrimp.
Crabs and shrimp. So what is chitosan oligosaccharides, the KitoMax, and where does that come from?
Yes. KitoMax is a product made by the enzymatic digestion of chitosan into a low molecular weight form. It is manufactured from the shells of red crabs that naturally grow on the east coast of Korea, of course, South Korea.
So there is a difference between chitosan and chitosan oligosaccharides, and I've seen where chitosan is marketed as a fat absorber for weight loss, while chitosan oligosaccharides, which is KitoMax, is marketed as a carb blocker for supporting our healthy glycemic response. And I was wondering if you can kind of explain the differences between these two, one being a fat absorber and one being very healthy for our glycemic response.
Yes, it's a very good question. The mechanism of the action for weight loss with chitosan actually is not clearly understood so far, but is thought to have similar effect to plant dietary fiber. In contrast, KitoMax works by inhibiting the activity of enzymes in the small intestine that absorb carbohydrates, thereby lowering the rapid increase in blood sugar levels.
So are there any reasons why chitosan should not be consumed due to its large molecular weight?
Yes, high molecular weight chitosan can form chelated bond with various minerals and excrete them, which can cause side effects for people who absolutely need iron, such as people with anemia.
Okay, so the large molecular chitosan can cause issues with minerals such as iron.
Yes.
Okay, so why is chitosan oligosaccharides, the KitoMax, a more beneficial and safer alternative to chitosan? And does it cause any kind of micronutrient deficiencies or side effects?
Oh, yes, yes, totally different. Chitosan has a molecular weight ranging from 500,000 to 2 million Dalton and is not soluble in water or the small intestine. However, KitoMax, with a molecular weight of less than 1,000 Dalton, dissolved well in water, even the small intestine, and does not causes any micronutrient binding. As we mentioned earlier, chitosan forms chelate bond with various minerals and prevent them from being absorbed in the small intestine and can definitely cause mineral deficiency. In addition, chitosan can disturb the large intestine, causing flatulence and diarrheas.
But not the chitosan oligosaccharides, just the
Yes,
chitosan.
yes.
Okay, so how does chitosan oligosaccharides, the KitoMax, outperform chitosan for healthy carbohydrate metabolism and glucose metabolism and glycemic response? What have studies shown?
Oh, yes, unlike high molecular weight chitosan, KitoMax is designed to bind with specific enzyme involving the breakdown and absorption of carbohydrate in our small intestine. To date, there have been no research report showing that high molecular weight chitosan inhibit the carbohydrate breakdown and even absorption enzyme we target. KitoMax has been evaluated in 3 different clinical trials and has confirmed the effect on reducing the absorption of dietary carbohydrate, resulting in a normal blood glucose level.
So when we talk about reducing the absorption of dietary carbohydrates, what forms of sugar or glucose and carbohydrates are being blocked in the small intestine? And why is this healthy for individuals?
Oh, yes, in our small intestine, enzymes such as alpha glucosidase break down and absorb the ingested sugar, like sucrase, which break down sugars, and amylase, which break down the starches. KitoMax inhibit the activity of these enzymes, so delaying the absorption of ingested carbohydrate into the blood, thereby suppressing the rise in blood sugar level after meal. This result was obtained by consuming bread and even sugar together with KitoMax. This is healthy because it reduces glycemic index of food product and postprandial glucose level after our meal.
This is very important. I know even for myself, with my glucose management, I'm taking the glucoraze product with KitoMax. Dr. Apostolidis, do you have any additional questions for Dr. Kwon? You're on mute.
I'm so sorry.
Thank you.
Yes, I do. But before I go to the questions, I would like to also thank President O and Dr. Kwon for being here with us today. And I want to disclose that I have been working with Kunpoong Bio for the past 15 years, maybe more, very close with President O and with Dr. Kwon. And in the capacity as the director of the advisory board, I have contributed in the development of KitoMax that we use in order to make the product glucoraze that we offer. So the questions that I have is actually a little bit different than what Dr. Bickerton asked. We discussed about the blood glucose lowering effects. To your knowledge, are there any benefits of Chitosan oligosaccharide besides supporting healthy glycemic response and healthy insulin sensitivity?
Oh, yes. Besides the blood glucose level control effect, it has been reported to promote the growth of beneficial intestinal microorganisms, such as lactic acid bacteria, known as a prebiotic effect.
Very good. And because we discussed extensively about the side effects of Chitosan, are there any side effects that are reported with Chitosan oligosaccharide?
There are no any other there are no reported side effects other than the selfish allergy so far.
Very good. And Chitosan is indeed a high molecular weight compound that can cause mineral deficiencies. Can something like this happen with Chitosan oligosaccharide?
Since this is low molecule, KitoMax, so there are no reported cases of any nutrient deficiency.
Very good, very good. And the last question I have is about the molecular weight of Chitosan oligosaccharides. So all Chitosan oligosaccharides are digested chitosans. Are there different qualities of Chitosan oligosaccharides depending on the different molecular weight, the low versus high molecular weight Chitosan oligosaccharide?
Oh, yes. The effectiveness of Chitosan oligosaccharide varies with molecular weight. KitoMax is produced with a molecular weight of less than 1,000 daltons and has been proven effectiveness through the various human clinical trials, 3-4 different clinical trials. The general and commercial Chitosan oligosaccharide have a molecular weight ranging from usually 3,000 to 10,000 daltons, and there are currently no research report proving their effect on the blood glucose level reduction so far.
Very good. And to this, I would like to also add that I'm sure you remember, Dr. Kwon and President O, the first research we did in order to develop KitoMax was to understand the effect of different molecular weights, Chitosan oligosaccharides. And that's how we decided to focus on this molecular weight that KitoMax right now has below 1,000 kilodaltons. Thank you so much from my side as well, Dr. Bickerton.
It's my pleasure. It's my
Yes,
pleasure.
thank you both for being here. And I just want to tell all of our listeners, if you would like more information about KitoMax or the Nutramins glucoraze, please go to nutramins.us and you can reach out to us. All of our health practitioners, we're happy to talk to you, and Dr. Apostolidis is happy to have a meeting with you to talk about any of the ingredients and the research. So thank you both so much for being here.
Thank you so much. It's my pleasure to see all you guys. It was a very nice meeting. Tk you.
Very nice meeting you too.
Bye-bye.